Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about a topic near and dear to my heart, and that is blood pressure. And personally, I feel that everybody's blood pressure can be better managed with lifestyle. I've certainly written and done enough videos on this to point out how much our lifestyle choices have to do with blood pressure. The challenge is that I really don't think that most people get the right information. Things like just merely going out and getting some sunlight can help your body make more nitric oxide, which can help lower your blood pressure. And if your doctor has not given you that advice, then maybe it's time to find a new one that will, who really understands that blood pressure is a marker of things not being happy. In almost every case, it's actually prediabetes in hiding or diabetes in hiding. So if you live an anti-diabetic lifestyle, blood pressure gets better. And blood pressure is this amazing dance of control of blood vessels opening up and closing down dynamically as needed. And a blood pressure medication comes in and just slams down control on that and completely loses the orchestration of blood pressure. It's kind of like going into a symphony and hearing a fantastic piece being played, and then somebody starts walking through with a jam box playing the loudest rap you could ever imagine from the back of a 1983 Chevy Citation. So this particular study looked at resistant hypertension, and I firmly believe that there really isn't a resistant hypertension. It's just it didn't respond to medication the way we expected. And so people have one or two medications and it's just not coming down. That means that lifestyle needs to be better managed. If you're on any medication, I strongly consider blood pressure not being managed. It's just being artificially controlled. So in this particular study, they looked at, and by the way, the author said the value of lifestyle changes and exercise in helping with resistant high blood pressure is the value is unknown, which is just ridiculous to suggest that our choices wouldn't play a role in blood pressure. Just because we haven't seen it in a study means it hasn't been done, not that it's not effective. So in this particular study, they looked at was 140 people with high blood pressure. The average age of 63. 31% had diabetes and 21% had chronic kidney disease, and you better believe there's some overlap there. And I would bet that 31% were diagnosed with diabetes, the other 69%, excuse my math, I'm off, just are pre-diabetic or haven't been diagnosed. And so they had them follow, there's a specific plan that is basically a coaching session that involves dietary changes, exercise, and as well as healthy behavioral changes. So, and they compared it to just a single visit with a primary care doctor or a nurse-led educator. And pretty much every marker that they looked at got better. Now, not fantastically better. And by the way, this was over the course of 4 months. And not fantastically better, but better. And these were people who were being poorly managed on the front end. So it just goes to show that even in some of the more resistant cases, that even above and beyond what we thought we were doing, that healthy lifestyle choices, the right type of exercise, and the right type of behavioral modifications can play a role in blood pressure. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.